In 2019, St. Tammany Health System introduced the North Shore to Transcatheter Aortic Valve Replacement, better known by its acronym TAVR, minimally invasive heart valve replacement that doesn't require open heart surgery.
My name is Richard Hodson. This is my wife, Julia Ann, and I was the first TAVR patient at St. Tammany Parish Hospital.
But how does it work? As this animation shows, it starts with a surgeon inserting a catheter, a hollow tube containing a new valve, through a small incision, usually in the groin, and guiding it to the heart, with help from a special X-ray machine. The new valve, which is attached to a mesh superstructure similar to a stent, is positioned into the malfunctioning aortic valve, then expanded. The catheter is then retracted, leaving in place the new valve, which immediately takes over for the malfunctioning valve. The procedure is then complete, with most patients returning home the same day.
We like LSU sports. We got season tickets, football, baseball. And right after the procedure, I missed the Utah State game, but the following week I went to the Florida game and even walked up the steps.